హలో అండి, నమస్కారం. నేను డాక్టర్ Abinav Reddy, కన్సల్టెంట్ డయాబెటాలజిస్ట్ అండి. డాక్టర్ మోహన్స్ డయాబెటిస్ స్పెషాలిటీ సెంటర్ వరంగల్ అండి. సో ఈరోజు ఈ ఫేస్‌బుక్ లైవ్ చేయడానికి కారణం ఏంటంటే, బాగా కోవిడ్ కేసెస్ బాగా పెరుగుతున్నాయి. సో ఈ కోవిడ్‌కి, డయాబెటిస్‌కి ఏమన్నా లింక్ ఉందా? లేదా డయాబెటిక్ పేషెంట్స్ ఎలాంటి జాగ్రత్తలు పాటించాలి? కోవిడ్ బారిన పడొద్దు అంటే, సో దీని గురించి మనం మాట్లాడుకుందాం. సో టుడే విల్ బి టాకింగ్ అబౌట్ కోవిడ్ అండ్ డయాబెటిస్. సో ఈస్ దేర్ ఎనీ రిలేషన్ బిట్వీన్ diabetes and COVID? And does COVID virus really cause diabetes? And what precautions diabetic patients should take to get faster recovery from COVID and to prevent from getting COVID infection? So basically, ఏంటంటే తెలుగు I'll be talking in Telugu and English as well because I have lots of Telugu patients. So కోవిడ్ వైరస్ యూజువల్‌గా ఏం చేస్తుంది అంటే బేసిక్‌గా ఇది సార్స్ కోవిడ్-2 అనేది సివియర్ అక్యూట్ రెస్పిరేటరీ డ్రోన్ కోవిడ్-2. సో ఇది వుహాన్‌లో ఫస్ట్ మనకు 2019లో గుర్తించడం జరిగింది. సో ఈ వైరస్ బేసిక్‌గా ఏంటంటే బాగా ఊపిరితిత్తులను ఎఫెక్ట్ చేస్తుందండి. లంగ్స్‌ని ఎఫెక్ట్ చేస్తుంది. సో మిగతా అవయవాలను కూడా ఎఫెక్ట్ చేయొచ్చు. సో బేసిక్‌గా లంగ్స్‌ని ఎఫెక్ట్ చేస్తుంది. సో దీని లక్షణాలు ఏంటంటే జ్వరము, దగ్గు, సర్ది, బాగా విపరీతంగా నీరసంగా ఉండడం, చాతన కాకుండా ఉండడం, కొంతమందికి స్మెల్ పోవడం జరిగింది. సో ఫస్ట్ అండ్ సెకండ్ వేవ్‌లో చాలా మందికి చూసాము. సో ఈ స్మెల్ పోవడం అనేది జరిగింది. బట్ ఈ రీసెంట్ థర్డ్ వేవ్‌లో ఏంటంటే స్మెల్ పోవడం అనేది జరగట్లేదు. సో సివియర్ వీక్‌నెస్ అండి, బాడీ పెయిన్స్, ఫెటీగ్, ఆకలి కాకపోవడము, లేదా కాఫ్, కోల్డ్ ఇవి బాగా చూస్తున్నాం. సో ఇలాంటి లక్షణాలు ఎవ్వరికున్నా గానీ ఖచ్చితంగా కోవిడ్ టెస్టింగ్ అనేది చేయించుకోండి. సో ర్యాపిడ్ టెస్టింగ్ ఒకటి ఉంటుంది, లేదంటే ఆర్‌టీ-పీసీఆర్. సో ఇవి బేసిక్ టెస్ట్స్. సో ఇది కాకుండా ఒకవేళ సింప్టమ్స్ పర్సిస్ట్ అయ్యి బాగా దమ్ము, దగ్గు ఎక్కువుంటే తర్వాత సీటీ స్కాన్ అనేది చేయించుకోవాలండి. సో ఈ మెకానిజం ఏంటి అసలు? కోవిడ్ వైరస్ ఎలా వస్తుంది? ఎలా ఎఫెక్ట్ చేస్తుంది? అనేది ఇంపార్టెంట్. సో ఈ వైరస్ ఎలా స్ప్రెడ్ అవుతుంది అంటే రెస్పిరేటరీ డ్రాప్లెట్స్. ఇప్పుడు సపోజ్ ఎవరన్నా తుమ్ముతాము, దగ్గుతాము. సో ఏమవుతుందంటే ఇప్పుడు సపోజ్ కోవిడ్ బారిన పడ్డ పేషెంట్ తుమ్మినా, దగ్గినా డ్రాప్లెట్స్ స్ప్రెడ్ అవుతాయి. సో ఆ డ్రాప్లెట్స్ సర్ఫేస్ పైన స్ప్రెడ్ అవుతాయి. సో ఆ సర్ఫేస్ పైన మనం ముట్టుకున్నాం సపోజ్, ముట్టుకొని మన ముక్కుకి, నోట్లో నుంచి ఎక్కడైనా టచ్ అవుతే ఏమవుతుందో ఆ వైరస్ మన లోపలికి వెళ్తుంది. సో ఫస్ట్ ప్రివెన్షన్ ఏంటి? ఎలా ముట్టుకోవద్దు. సో సర్ఫేసెస్ ముట్టుకోకుండా ఉండాలి. సో నెక్స్ట్ ఏంటంటే సోషల్ డిస్టెన్సింగ్ ఫస్ట్. సో సోషల్ డిస్టెన్సింగ్ అట్‌లీస్ట్ ఎంత డిస్టెన్స్ ఉండాలి? అట్‌లీస్ట్ 6 ఫీట్ డిస్టెన్స్ మెయింటైన్ చేయాలండి ఎవరికైనా. సో ఫస్ట్ సోషల్ డిస్టెన్సింగ్, తర్వాత వచ్చేసి మాస్కింగ్. సో మాస్కింగ్ చాలా ఇంపార్టెంట్ ప్రికాషనరీ. సో మాస్క్ ఎలా వేసుకోవాలనేది చాలా ఇంపార్టెంట్. చాలా మంది ఏం చేస్తారు, మాస్క్ మూతి మీదనో లేకపోతే ముక్కుకు సగం వేసుకోవడం చేస్తారు. సో ఎలా మాస్క్ వేసుకోవాలనేది చూపిస్తా. సో ఇలా మాస్క్ ఉంది కదా, సో మాస్క్ పక్కన ఇలా మనకి రెండు ఉన్నాయి కదా. సో ఏం చేయాలి, ఫస్ట్ మనము మాస్క్ ఇలా పట్టుకొని సో ఈ సర్ఫేస్‌ని టచ్ చేయొద్దు. సో ఇలా ముక్కు కవర్ కావాలి ఫస్ట్. సో జస్ట్ మనం పట్టుకోవాల్సింది ఇది. సో చెవుల వెనుకకి ఇలా వేసేసుకోవాలి. సో వేసుకున్న తర్వాత ఏం చేయాలి, ఈ నేసల్ బ్రిడ్జ్ ఏదైతే ఉన్నదో దీన్ని ఇలా క్లోజ్ చేసి మాస్క్‌ని ఇలా టచ్ చేయాలి. సో దట్ ఇక్కడ నుంచి వైరస్ పార్టికల్స్ ఎళ్ళవు, ఇక్కడ నుంచి ఎళ్ళవు, ఇక్కడ నుంచి ఎళ్ళవు. సో నోస్, మన మౌత్ ప్లస్ చిన్. సో ఈ 3 పార్ట్స్ కవర్ చేసుకోవాలి. సో మాస్క్ తీయడం కూడా ఇంపార్టెంట్. సో ఎప్పుడైనా ఈ ఔటర్ సర్ఫేస్‌ని టచ్ చేయొద్దు. ఔటర్ సర్ఫేస్ ఎందుకు టచ్ చేయొద్దు? బయటికెళ్తాం, ఎవరైనా తుమ్ముతారు, దగ్గుతారు. సో ఈ ఏరియాస్‌లో మనకి వైరస్ పార్టికల్స్ ఉంటాయి. సో ఈ భాగం టచ్ చేయకుండా ఎలా తీయాలి మాస్క్? ఒకవేళ సపోజ్ టచ్ చేశామనుకో మళ్ళీ శానిటైజ్ చేసుకోవాలి. సో మాస్క్ తీయడం కూడా ఇంపార్టెంట్. ఎలా మాస్క్ తీయాలి? సేమ్ ఎలా అయితే వేసుకున్నామో ఇదే విధంగా మాస్క్ తీయాలి. సో ఇది. సో హౌ టు వేర్ అ మాస్క్ అనేది చాలా ఇంపార్టెంట్ అండి. సో మనం మాస్కింగే చాలా ఇంపార్టెంట్. సో లాస్ట్ ఏంటంటే శానిటైజేషన్, ఎస్ఎంఎస్ అంటాం. సో శానిటైజేషన్‌లో ఇంపార్టెన్స్ ఏంటంటే చేతులు సరిగ్గా కడుక్కోవడం. సో అట్‌లీస్ట్ 20 సెకండ్స్ అన్నా మనం హ్యాండ్ వాషింగ్ అనేది చాలా ఇంపార్టెంట్. ఐదర్ సోప్ తోని కూడా చేసుకోవచ్చు 20-40 సెకండ్స్ అన్నా, లేదంటే శానిటైజర్ విత్ అట్‌లీస్ట్ 60% ఆఫ్ ఆల్కహాల్ ఉండాలండి ఆ శానిటైజర్‌లో. సో అలాంటి వాటితోని మనం శానిటైజ్ చేసుకోవచ్చు. సో ఈ 3 ప్రికాషన్స్ ఫస్ట్ తీసుకోవాలి. సో కోవిడ్, డయాబెటిస్‌కి ఏమన్నా లింక్ ఉందా ఫస్ట్? సో చాలా మంది అడుగుతారు, డయాబెటిక్ పేషెంట్స్ ప్రతి ఒక్కరికి కోవిడ్ రావడానికి ఛాన్స్ ఉంటుందా అని. లేదండి, ఇది ఒక అపోహ. సో ఎవరికైతే షుగర్ లెవెల్స్ కంట్రోల్ ఉంటాయో, సపోజ్ రూమ్‌లో తీసుకోండి. సో ఒక 10 మంది ఉన్నారు. దాంట్లో నలుగురు డయాబెటిక్, నలుగురు నాన్ డయాబెటిక్ అనుకోండి. మిగతా ఇద్దరికి ఏం డిసీజ్. సో 10 మెంబర్స్‌కి కోవిడ్ ఇన్ఫెక్షన్ ఒక పేషెంట్ నుంచి, ఒక కోవిడ్ పేషెంట్ నుంచి రావడానికి ఈక్వల్ ఛాన్స్ ఉంటుందండి. సో అదేం లేదు, డయాబెటీస్ ఉంటే ఖచ్చితంగా కోవిడ్ ఇన్ఫెక్షన్ వస్తుంది అనేది ఏం లేదు, అది జస్ట్ ఒక అపోహ. సో కాకపోతే ఏంటంటే డయాబెటిక్ పేషెంట్ కి కోవిడ్ వస్తే దానివల్ల కాంప్లికేషన్స్ చాలా ఎక్కువ ఉంటాయండి. ఎందుకంటే డయాబెటీస్ ఒక ఎలాంటి డిసీజ్ అంటే దీంట్లో ఏంటంటే ఇన్ఫ్లమేషన్ అనేది ఉంటుంది, అంటే ఒంట్లో వాప్ అనేది నార్మల్ గానే డయాబెటిక్ పేషెంట్స్ లో కొంచెం ఎక్కువ ఉంటుంది. సో ఈ కోవిడ్ వైరస్ కూడా ఏం చేస్తుందండి, ఇది కూడా హైపర్ ఇన్ఫ్లమేటరీ స్టేట్. సో ఇన్ఫ్లమేషన్ లోపల వాపు అనేది ఎక్కువ కాజ్ చేస్తుంది. సో టూ ఇన్ఫ్లమేటరీ స్టేట్స్ కలిపి ఏమవుతుందంటే కాంప్లికేషన్స్ రావడానికి ఛాన్స్ ఎక్కువ ఉంటుంది. సో రికవరీ ఛాన్స్ డయాబెటిక్ పేషెంట్స్ లో చాలా టైం పడుతుంది రికవర్ అవ్వడానికి. అదే విధంగా పాన్క్రియాస్ ని ఎఫెక్ట్ చేస్తుందా, సో కోవిడ్ వైరస్ అనేది కూడా ఒక పెద్ద క్వశ్చన్. సో యూజువల్ గా కోవిడ్ వైరస్ ఎంటర్ కాగానే ఏమవుతుందంటే అది లంగ్స్ ని ఎఫెక్ట్ చేస్తుంది. సో ACE2 రిసెప్టార్స్ అని ఉంటాయి. సో ఈ వైరస్ ఒక స్పైక్ ప్రోటీన్ అనేది ఉంటుంది. సో ఇది వెళ్ళి ఆ రిసెప్టార్స్ ని పోయి అంటుకుంటుంది, అంటుకున్నాక ఆ వైరస్ రెప్లికేట్ అవుతుంది బేసిక్ గా. సో పాన్క్రియాస్ లో కూడా మన బీటా సెల్స్ లో కూడా ACE2 రిసెప్టార్స్ ఉంటాయి. సో అక్కడికి కూడా అది వెళ్ళి అటాచ్ అయ్యి సో డయాబెటీస్ కాజ్ చేస్తుందా అనేది ఇంకా పరిశోధనలో ఉంది. సో చాలా మంది పేషెంట్స్ ని చూస్తున్నాం, కోవిడ్ వచ్చిన తర్వాత షుగర్ లెవెల్స్ పెరుగుతున్నాయి చాలా మందికి. కొంతమందికి ఏమో డయాబెటీస్ డిటెక్ట్ అవుతుంది, ఎప్పుడు హాస్పిటల్లో కోవిడ్ ద్వారా అడ్మిట్ అవుతున్నారు, చూసేసరికి ఆల్రెడీ షుగర్స్ ఉంటున్నాయి. సో ఇక్కడ ఒక పెద్ద క్వెరీ ఏంటంటే వీళ్ళు ప్రీ డయాబెటిక్ స్టేజ్ లో ఉన్నారా, లేదా వీళ్ళకి ఆల్రెడీ షుగర్ ఉంది కానీ స్క్రీనింగ్ చేయించుకోలేదు, ఎప్పుడు షుగర్ ఉందని తెలియదు, సో వైరస్ బారిన పడ్డాక షుగర్ వచ్చిందా. సో ఈ 3 క్వెరీ మార్క్స్ అండి. సో ప్రీ డయాబెటిక్ ఉన్న వాళ్ళకి కోవిడ్ రావడానికి ఛాన్స్ ఎక్కువ ఉంటుంది. సో అలా వచ్చిందా, లేదంటే ఆల్రెడీ షుగర్ ఉంది కానీ మనకు షుగర్ ఉందని తెలియదు, సో అలా వస్తుందా, లేదంటే కోవిడ్ వైరస్ వల్లనే మనకి షుగర్ వచ్చిందా. సో ఈ లాస్ట్ స్టేట్మెంట్ కోవిడ్ వల్ల షుగర్ వచ్చిందా అనే దానికి ఇంకా చాలా పరిశోధనలు జరుగుతున్నాయి, రీసెర్చ్ పేపర్స్ పబ్లిష్ అవుతున్నాయి. సో చాలా తక్కువ డేటా ఉంది, ఇంకా మనకి క్లారిటీ అనేది లేదండి. సో ఇట్ విల్ టేక్ టైం. నిజంగానే కోవిడ్ వైరస్ మన ప్యాంక్రియాటిక్ బీటా సెల్స్ ఎఫెక్ట్ చేస్తున్నాయా లేదా అనేది ఇంకా తెలియాలి. సో అదే విధంగా ఇది ఒక మెకానిజం. సో తర్వాత కోవిడ్ డయాబెటీస్ లో ముఖ్యంగా మనం చూసేది ఏంటంటే కోవిడ్ ఇన్ఫెక్షన్ రాగానే చాలా మందికి స్ట్రెస్ లెవెల్స్ పెరుగుతాయి. సో అబ్బో నాకు కోవిడ్ వచ్చింది నేను చనిపోతానా, లేదా పక్కింటి వాళ్ళకి వచ్చింది నాకేమన్నా అవుతుందా అనే స్ట్రెస్ లెవెల్స్ బాగా పెంచుకుంటాం. సో ఫిజికల్ స్ట్రెస్ ఒకటి, ఎమోషనల్ స్ట్రెస్ చాలా ఇంపార్టెంట్. సో అవి పెట్టుకోరు. సో పక్కన వాళ్ళకి ఇన్ఫెక్షన్ వస్తే వచ్చింది, మనకు వస్తే ఏం చేయాలనేది ఆలోచించాలి. సో స్ట్రెస్ లెవెల్స్ తగ్గించుకోండి. సో డయాబెటీస్ ఎవరికైతే డయాబెటీస్ ఉన్న వాళ్ళకి కోవిడ్ వచ్చిందో సో డిక్రీజ్ యువర్ స్ట్రెస్ లెవెల్స్. ఏమైనా డిప్రెషన్, కొందరికి డిప్రెషన్ రావడానికి కూడా ఛాన్స్ ఎక్కువ ఉంటుంది. చాలా మందికి నిద్ర రావట్లేదు, ఇన్సోమ్నియా అంటాం. సో ఇలాంటివి కూడా కోవిడ్ వైరస్ వల్ల అవుతుంది. సో డైటరీ ప్యాటర్న్స్, సో బ్యాలెన్స్డ్ డైట్ అనేది చాలా ఇంపార్టెంట్. ఎవరికైతే కోవిడ్ వచ్చిందో సో వాళ్ళందరూ బ్యాలెన్స్డ్ డైట్ తీసుకోండి. సో ప్రోటీన్ ఎక్కువ ఉండాలి, ఫ్యాట్స్ తక్కువ ఉండాలి, కార్బోహైడ్రేట్ ఇంటెక్ తక్కువ ఉండాలి. ప్రోటీన్ అండ్ ఫైబర్ ఆర్ వెరీ ఇంపార్టెంట్. ఎందుకంటే చాలా మందికి ఫెటిక్ అంటే నీరసం ఎక్కువ ఉంటుందండి. సో పోస్ట్ కోవిడ్ ఫెటిక్ సిండ్రోమ్ కూడా అంటాము. సో అది చాలా రోజులు ఉంటుంది, 1 month 2 months వరకు కూడా ఉంటుంది కొంతమంది. సో మంచి యాంటీ ఆక్సిడెంట్స్, ఫ్రూట్స్, గ్రీన్ లీఫీ వెజిటేబుల్స్ బాగా తీసుకోండి. సో ఇది ఇంపార్టెంట్. నెక్స్ట్ డ్రింక్ ప్లెంటీ ఆఫ్ వాటర్ అండి. వాటర్ బాగా తీసుకోవాలి. సో వాటర్ చాలా ఇంపార్టెంట్, ఎందుకంటే డిహైడ్రేషన్ అవ్వడానికి ఛాన్సెస్ ఎక్కువ ఉంటాయి బాగా. సో ఒకవేళ కిడ్నీ పేషెంట్ కానీ హార్ట్ పేషెంట్స్ కానీ అయితే వాళ్ళకి కొన్ని రెస్ట్రిక్షన్స్ ఉంటాయి, వాటర్ ఇంటేక్ ఇంత తీసుకోవాలి అని. సో వాళ్ళ డాక్టర్ని కన్సల్ట్ చేసి తగినంత వాటర్ మాత్రం తీసుకోవాలి. సో సపోజ్ ఒకరికి కోవిడ్ తో సోకింది ఇంట్లో, సో చిన్న పిల్లలకి ప్లస్ ఎల్డర్లీకి కొంచెం దూరంగా ఉండండి. అట్లీస్ట్ ఒకవేళ మైల్డ్ సిమ్టమ్స్ ఉంటే అట్లీస్ట్ ఒక 7 days అన్న ఐసోలేషన్ లో ఉండండి. ఒకవేళ సివియర్ సిమ్టమ్స్ ఉంటే అట్లీస్ట్ మినిమం 10 days అన్న ఐసోలేషన్ లో ఉండండి. సో ఇమ్యూనిటీ బిల్డ్ చేసుకోవాలి. ఎలా ఇమ్యూనిటీ బిల్డ్ చేసుకోవాలి? డయాబెటిక్ పేషెంట్స్ రెగ్యులర్ ఎక్సర్సైజింగ్ చేయాలి. సో ఎక్సర్సైజ్, గుడ్ స్లీప్ అండి చాలా ఇంపార్టెంట్ ఇమ్యూనిటీ బిల్డ్ చేసుకోవడానికి. సో స్ట్రెస్ నుంచి రిలీఫ్ కావాలి. సో స్ట్రెస్ నుంచి ఎలా రిలీఫ్ అవుతారు? చాలా మందికి కొన్ని యాక్టివిటీస్ ఉంటాయి. సో ప్లేయింగ్ గేమ్స్ కానీ, సో కొందరు కార్డ్స్ ఆడతారు, కొందరు ఫ్రెండ్స్ తో బయటికి వెళ్ళాలి. సో ఏది మీకు డీస్ట్రెస్ చేస్తుందో సో అలాంటి యాక్టివిటీస్ చేయండి, సో దట్ ఫాస్టర్ రికవరీ ఉంటుంది. సో ఈ కోవిడ్ లో యూజువల్ గా ట్రీట్మెంట్ 3 types అండి. మైల్డ్ ఉందా, మోడరేట్ ఉందా, సివియర్ ఉందా. సో దాన్ని బట్టి మన ట్రీట్మెంట్, డయాబెటిక్ యొక్క ట్రీట్మెంట్ కూడా మారుతుంది. సో మైల్డర్ కేసెస్ అనుకోండి, సో మైల్డ్ కోవిడ్ వచ్చింది అనుకోండి, సో డయాబెటిక్స్ మనం తీసుకునే టాబ్లెట్స్ లో పెద్ద మార్పులు ఏం జరగవు. సో కాకపోతే సివియర్ కోవిడ్, మోడరేట్ టు సివియర్ కోవిడ్లో ఏంటంటే ఇన్సులిన్ తీసుకోవాల్సి ఉంటుంది అట్లీస్ట్ కొన్ని రోజులైనా. సో ఖచ్చితంగా కోవిడ్ వచ్చిన వాళ్ళు పోస్ట్ కోవిడ్ ఖచ్చితంగా డాక్టర్ని, మీ డయాబెటిక్ డాక్టర్ని సంప్రదించండి. సో మీ షుగర్ లెవెల్స్ ఎలాగో కొన్ని రోజులు ఎక్కువనే ఉంటాయి. సో ట్రీట్మెంట్ డ్రగ్స్ ఏమైనా మారుస్తారా? కొన్ని డ్రగ్స్ ఉంటాయండి, SGLT2 ఇన్హిబిటర్స్ అంటాం, థయోజోలిడోన్స్ అని అంటాం, పయోగ్లిటజోల్, ఇలాంటి టాబ్లెట్స్ ఉంటే విత్డ్రా చేస్తే బెటర్ అండి. సో ఎందుకంటే ఇలాంటి కొన్ని టాబ్లెట్స్ కొన్ని వాపు కాజ్ చేస్తాయి, కొన్ని ఏమో డిహైడ్రేషన్ కాజ్ చేస్తాయి. సో ఇలాంటి టాబ్లెట్స్ మనం విత్డ్రా చేస్తే బెటర్. విత్డ్రా చేసి ఇన్సులిన్ పైన పెట్టడము, లేకపోతే వేరే గ్రూప్ మాలిక్యూల్స్ పెట్టడము ఆ టైంకి చాలా యూస్ఫుల్ ఉంటుంది. సో కొన్ని క్వశ్చన్స్ వచ్చాయి అలాగే. సో మనం ఇన్ ద మీన్ వైల్ సో ఈ క్వశ్చన్స్ కొన్ని మనం ఆన్సర్ చేద్దాము. సో మధ్యలో ఇఫ్ ఎనీ కైండ్ ఆఫ్ మీకు ఏమైనా కోవిడ్, డయాబెటీస్ రిలేటెడ్ క్వశ్చన్స్ ఉంటే చాట్ బాక్స్లో మీరు డెఫినెట్గా టైప్ చేయొచ్చు. సో రేవతి రవికుమార్ గారు అడుగుతున్నారు, సో సార్ డయాబెటీస్ కాజ్ గ్యాస్ట్రిక్ ప్రాబ్లమ్స్. Diabetes as such doesn't cause any gastric problems, but the motility of the intestine will decrease. Usually diabetic patients have over longer time they have constipation problems, so paralytic ileus antam. So the motility, intestinal motility అనేది కొంచెం తగ్గుతుందండి. సో ప్రోకైనెటిక్ డ్రగ్స్ అంటాం. సో మొటిలిటీ పెంచడానికి మనం కొన్ని డ్రగ్స్ ఇవ్వాల్సి ఉంటుంది. సో కాన్స్టిపేషన్ చాలా చూస్తాం డయాబెటిక్ పేషెంట్స్ లో. సో నైట్ మీరు ఇసబ్గుల్ హస్క్ పౌడర్ కానీ ఇలాంటివి ఏమైనా తీసుకోవచ్చు కాన్స్టిపేషన్ కోసం. సో నెక్స్ట్, మై హస్బెండ్ నాట్ టేకింగ్ స్మాల్ ఫుడ్ యాజ్ హీస్ నాట్ హంగ్రీ. రేవతి గారే అడుగుతున్నారు. సో వై యువర్ హస్బెండ్ ఈస్ నాట్ టేకింగ్ స్మాల్ ఫుడ్స్, ఈస్ నాట్ హంగ్రీ, వీ హ్యావ్ టు అనలైజ్. సో రైట్ టు అస్ వాట్ మెడిసిన్ హీ ఈస్ టేకింగ్. సో సమ్ ఆఫ్ ద టాబ్లెట్స్ ఆల్సో, డయాబెటిక్ టాబ్లెట్స్ ఆల్సో కాజ్ సెటైటీ అండి. సో ఏ కార్బోస్ ఆల్ఫా గ్లూకోసిడేస్ ఇన్హిబిటర్స్ అంటాము. సో ఏ కార్బోస్, ఓగ్లికోస్ అని కొన్ని టాబ్లెట్స్ ఉంటాయి. సో లార్జ్ కార్బోహైడ్రేట్స్ ఎక్కువ తీసుకునే వాళ్ళు, అట్లీస్ట్ ఇన్ ఇండియన్ పాపులేషన్, we prescribe these drugs. So some people when we prescribe these drugs may have gastric problems, lot of gas problems can happen. So if he is taking that kind of tablets, probably we have to withdraw it. So consult your doctor or write to us that number so that we can review what medicines you are taking. So is it due to the diabetic medicine that the gas problem is there, or other problems are there? We have to find out. So some investigations are also required. So she is saying he is full of stomach with tablets as he got brain tumor, operated 20 years back, taking Visalon 5 mg in morning, 2.5 mg in the evening. So Revati garu, he is taking a steroid. So that steroid also can cause a lot of gastric problems. Whether he is taking an antacid tablet or PPI tablet in the morning is important. And if he is diabetic with brain tumor and with the steroid, so please write to us so that I can help you. So Sada is asking, diabetes since 20 years, treatment at Mohan's Rajamandri, vaccine not taken, advise me. No, we have a good vaccine, both Covaxin, Covishield available here, Johnson & Johnson vaccine are there. So as we have an armamentarium in our hand, so first please get vaccinated. So you have to, diabetic patients should take COVID vaccine. Along with the COVID vaccine, you have to take a influenza vaccine and a pneumococcal vaccine. So influenza vaccine usually is taken yearly once, and pneumococcal vaccine usually 5 to 10 years, once in 5 or 10 years. So what these vaccines will do is they will create antibodies in our body, and when the infection comes into the body, they recognize that the virus has come. So severe symptoms we can avoid if you get once you get vaccinated. So vaccination is very much important. So please do not do this mistake by not getting vaccinated. So, and don't feel that vaccination will cause body pains, it will cause weakness. So that will be there for 1 or 2, 3 days. But if you get COVID virus infection in a diabetic patient, you may die. So next, Krishnamurthy is asking, my father maintaining the sugar levels well, but recently he feels more hungry. What would be the reason? So what reason? So Krishnamurthy garu, so you are saying sugar levels are fine. So when did you check your sugar levels? Whether you have checked your fasting sugar, postprandial sugar, how much is your HbA1c is very much important. Because many people, what mistake they do is just do a fasting and PP in the morning. You don't know how much sugars are there in the afternoon, what is your sugar level in the evening, what is it in the night, and what is your 3 months average sugar is very important. Because I have seen many patients, they just do fasting PP on the day of the test, they eat only this much of food, very little rice or less carbohydrate. Obviously, the dose will be sufficient and their sugar levels will be normal. They don't do a HbA1c, so you don't know how much your HbA1c is there. So, some patients HbA1c I see 11 with a fasting sugar of 90, postprandial sugar of 140. So, what is happening? Your evening sugars are high or the night sugars are high. So, probably Krishnamurthy garu do a HbA1c. If your HbA1c is also normal, suppose if it is less than 7, do a sugar in the afternoon and in the night, before break, before lunch and after lunch, before dinner, after dinner. If all the sugars are normal, then we have to search the cause why he is more hungry. Because a diabetic patient, if he is feeling more hungry, his sugar levels are not under control. If he is having going for frequent urination, then definitely he has to check his blood sugars. If he's more thirsty, so these are the three symptoms, more thirsty also, then you have to check your sugar levels. So Revati is asking, sir, he's taking Vertin 8 mg, Eltroxil 125 mg, so he's hypothyroid as well. Encorate Chrono is for seizures, Ecosprin, Rosavel, Gmer 2 he's taking, and Glimibrit M1 is 5500 along with Pandy per day. Will you give me some suggestions? Okay, so we don't have Revati ji, so we don't have any kind of alpha glucosidase inhibitors in the prescription that is there. So we have to see why the gas problem is happening. With Ecosprin 75 also the gas problem can happen. So instead of Pan-D, probably we can change it to another molecule and try. Or is he having some ulcer? So further some investigations are required. So sometimes plain metformin can also cause gastric problem. So I want to know since how many days he's using this regimen. So some more information is required. So Sujata Garu is saying thanks. Sridevi is saying namaste sir. Satvik is saying sir, how can I consult you personally, which branch? So Satvik, you can consult, you can call the number which is scrolling here. I work in Warangal branch. So in Nakalagutta. So Sandhya Rani is saying, which one is dangerous, type 1 or type 2? So nothing is dangerous. Diabetes is not so dangerous. We have all kind of medication. So it is treatable. So it is not a cancer so that it is dangerous, you will die. So it is treatable, it is controllable. So Sandhya Rani garu control cheskovali diabetes ane. So type 1, I'll say it is, you need to take insulin. Because what is the difference between type 1 and type 2 is, in type 1, there is no insulin secretion in your pancreatic beta cells. So when there is no insulin secretion, so from the date of onset, only you have to start poking. You have to take insulin either 2 times or 3 times or maximum 4 times. So most patients in type 1 require 4 times of insulin. So probably you can take it this way. It is dangerous in this way. So at least type 2 diabetes, you don't have to take insulin from the day 1. So there is some kind of insulin secretion is there in your body. So probably some tablets will work. But first time in type 2 also, almost 50% of your beta cells are gone. So in your life, only 50% of beta cells are there. So it is a progressive disease. From 50, it will go to 49, 48. It will keep on decreasing. So be disciplined from the date of onset of your sugar, whether type 1 or type 2. So type 2 in the initial part, it can be reversed also if you have good control, if you have some weight loss. So obviously type 1 is a bit dangerous than type 2. So type 2 also progresses to same insulin when the insulin secretion in your body goes down. So Devendra Srimalli is saying, sir, I am insulin dependent patient. Drink too much tea. Feel less hungry. So as you are insulin dependent patient, so obviously if you take tea 6 to 7 times, you will not feel hungry because it kills your hunger, tea. So please avoid taking too much tea. Only cup or once or twice is recommended. So Naresh is asking, do people with diabetes have a higher chance of serious complications from COVID? Yes, Naresh, obviously the complications risk is more higher in patients with diabetes because there is a cytokine storm which causes inflammation. There is generation of oxygen free radicals which we say. So it happens in diabetes and even in COVID. So if your COVID itself, if your sugar levels are high, what happens? The virus will replicate more. So chances of the virus staying in our body is more. So to come out of ICU also it will take more time. So that is the reason we say keep your blood sugars under control. At least during this COVID peaks, please check your sugars regularly. Do an SMPG. So check your fasting sugar after breakfast sugar one day. Next day you check before lunch, after lunch sugar. Other third day you check before dinner, after dinner sugar. All your sugar should be at least less than 180. Fasting sugar should be less than 110, and after food sugar should be less than 180. If your sugars are in this way, chances of getting COVID infection is also very low. So Sadwala Sai Teja is asking, my mother is taking 44 units insulin. Is it good, sir? She can take. So there is no barrier that you can take 44, 20, 30. There is no number. How much insulin is required to control your diabetes? That much insulin you have to take. I have patients who take 100, 120, 200 units, 300 units of insulin also. Because what happens as time progresses in type 1 or type 2, when your insulin secretion inside the body is almost negligible, there is a test called C-peptide. You can do that test. After you do the C-peptide, how much insulin secretion is there in your body, you can see. If your insulin secretion is negligible, no one can do anything. Even God also cannot do anything. So from outside, obviously, you have, if the oral hypoglycemic agents are not working, after 5, 10, 20 years, they will not work. That time we have to give insulin only. Suppose your exercise is low, you are not following proper diet, no balanced diet, no exercise, no proper sleep, you are having so much of stress, obviously your sugar levels will be high. So how much it is required, that much we have to give, whether it is 30, 40, 50, 60 or 70 respective. You have to control your sugar. Suppose a patient is having 100 units of insulin, sugars are under control, fasting, ppbs, hbnc, you have to take it lifelong. How much it is required, you have to take that much. There is no barrier of insulin. This much units you have to take. So, which vaccine is better, sir? Naresh is asking. So, there is nothing like that, Naresh. Which vaccine goes is better? Available vaccines are Covishield and Covaxin. Both you can take. Both the efficacies are similar compared to the US vaccines. In US vaccines, the Pfizer vaccine, Moderna vaccine are a step ahead compared to the Indian vaccines, the Covishield and Covaxin. So their efficacy is more high, around 92%, whereas Covaxin, Covishield around 70. But whatever are there, first please utilize the vaccine. Many people are not even taking vaccines. At least 70% protection you will have. So don't think about which vaccine is better, what is better. First take the vaccine. Which is available, take it. So Sridevi garu antunnaru, ma mother is diabetic patient. 5 days back she got fever. Only 1 day. Tarvata chala weakness vachindi. And also stomach pain vastundanta. Appudu lopata chuttinatlu pain vastundi. సో శ్రీదేవి గారు, మీ అమ్మగారికి జ్వరం వచ్చింది కరెక్టే, వీక్నెస్ అంటున్నారు, కడుపు నొప్పి అంటున్నారు. సో ఇవన్నీ లక్షణాలండి. ఇప్పుడైతే ఏది ఉన్నా కానీ ఫస్ట్ 5 డేస్ అయిపోయింది, లేదు 5 డేస్ బ్యాక్ ఫీవర్ వచ్చింది. సో వీక్నెస్ కి రీజన్ ఏంటి? చాలా మందికి మేము చూస్తున్నాం ఓన్లీ వీక్నెస్, ఫెటిక్ తో కూడా కోవిడ్ పాజిటివ్ వస్తున్నారు. సో ప్లీజ్ గెట్ టెస్టెడ్. ఫస్ట్ టెస్టింగ్ చేయించుకోండి, మీ అమ్మగారిని చేయించండి. సో కొన్ని రొటీన్ టెస్ట్ ఉంటాయి, సివిసి, సిఆర్పి ఇలాంటి కొన్ని టెస్ట్ లో మనకి ఇన్ఫెక్షన్ ఏమైనా ఉందా అనేది తెలుస్తుంది. అలాగే ఇప్పుడు కోవిడ్ బాగా పెరుగుతుంది కాబట్టి సో ఫీవర్ కి రిలేటెడ్ ఫీవర్ ప్రొఫైల్ టెస్ట్ ఉంటాయండి. సో ఒకసారి మీ ఫిజిషియన్ ని కన్సల్ట్ అవ్వండి. కన్సల్ట్ అయ్యి సో ఏ జ్వరం లాగా ఉంది ఏంటి అనేది ఐడెంటిఫై చేసి సో రొటీన్ గా ఒక కోవిడ్ టెస్ట్ కూడా ఖచ్చితంగా చేయించండి. సో చేయిస్తే ఇది ఏం జ్వరం అనేది మనకు తెలుస్తుంది, దాన్ని బట్టి మనం ట్రీట్ చేద్దాం. సో కాంతారావు కొల్లు, My missus using rhizodic insulin 26 units in the morning and 18 units in the night. Can she take that much insulin in one day besides diabetic tablets? Yes, just now I said, just now I talked. So there is no barrier to the amount of insulin, to the number of units of insulin that you take. How much ever is required, you have to take. Suppose with 26 in the morning and 18 and with some OHS, if it is in good control, you have to definitely take it, because ultimately our goal is to control diabetes. If you don't control diabetes, what happens? You will have all the complications from head to toe. So your liver will get affected, your kidney will get affected, you can have a heart attack, you can have a brain stroke, you can have diabetic neuropathy. So why you have to take diabetes treatment? To prevent all these complications only you have to take. So how much medicine is required, that much medicine should be taken. So Naresh, influenza or pneumococcal. So in diabetic patients, both should be taken. Influenza should be taken and pneumococcal should be taken. So influenza usually we give yearly once, pneumococcal 5 years once. So right now in this pandemic, so we are seeing lot of flu cases also. Whether it is due to fever, cold, cough, is due to flu, is due to corona, COVID. So we cannot differentiate whether this is due to flu or whether this is due to COVID. So if you have taken all the two COVID doses, so there should be a 14-day gap so that you can take influenza vaccine as well. So we are seeing flu and corona together, we are calling it as florona as well. So there are new terminology coming. So flu also is causing a longer period now. Usually it used to be 2 or 3 days. Now even 10 days also flu is also not going. So better vaccinated with, get vaccinated now initially with influenza and later date pneumococcal vaccine as well. So Sai Kumari Konduri, from 7 months I am suffering from diabetes, aged 59 years, employing, using Reclimet tablets. Okay, good. You can take Reclimet tablets as prescribed. So how your sugar control is very much important. Get regular testing done. Are you getting any complications? So if you have any complications like diabetic nephropathy, so your tablets should be changed. So depending on the screening of your vital organs like heart, kidney, liver, your feet, your diabetic treatment will also be changed. Okay. So should type 1 take long acting and short acting? Yes, obviously type 1 will require both long acting and short acting. So I'll tell you what insulin does actually. So short acting insulin, what it does is, so every human being will have at least 2 to 3 times of food. So what short acting will do is, after you eat, there is a surge in your blood sugar. So immediately that surge will be taken care of the short acting insulin. So what does long acting insulin does? So after some time also, after 2 3 hours also, so there is some amount of blood sugar in your blood. So that spikes will be taken care of long acting. So that is why what we do is short acting. How many times we give? 3 times we give: before breakfast, before lunch, before dinner. So to cut short the postprandial spike, we give short acting. So one long acting, why we give long acting, will act for around 24 hours. So background slowly, the insulin will be acting and the sugars will be under control. So controlling sugars for 24 hours is important. Not only in the morning, only in the afternoon, only in the night. So 24 hours it has to be controlled. So that is the logic behind short acting and long acting. So Bilveshwar Rao Shakar. So he's asking, my daughter type 1 diabetes, 20 years old. Now insulin uses. Your advice sometimes go highs or lows. When it comes normal level, no rapid she's doing uses 888 and Lantus 20. Sugar levels are 130 to 300 levels kindly. So type 1 diabetes, yes, as you already said, ups and downs are common in type 1 diabetes. So probably you have to see, is the postprandial sugar going up? Suppose your fasting is 130 is okay, 20, so you should maintain it at less than 130. So what you can do is you can increase a bit of Lantus here, and you have to see postprandial how much spike is there. So whether it is after breakfast it is increasing or after lunch, after dinner. So depending on the carbohydrate intake, we have to give the insulin. Suppose she's eating this much of rice, 2 bowls of rice. So if you take only 8 units, it will not be sufficient. So there is a carb count calculation to insulin ratio. So you can calculate it, how much carbohydrate she's taking. Depending on that, we have to give the insulin. So you can increase a bit of insulin and try, or otherwise we can change the long-acting insulin as well. And even the short-acting also we can change it, and we can give a regular insulin as well. So please kindly contact us, contact me or in the scrolling number so that we can help you. So there are some regimens we can change some insulins, and probably we can titrate. If it is not getting under control, we have an absolute device called AGP. So AGP is a small device. I can show you. This size it is. So there is a small filament here. So we can put this chip. This chip is kept here at the back of your hand. So what this does is, so what I told you right now, after breakfast, after lunch, after dinner, many people cannot poke this many times, right? So if you keep this chip here, this chip works for 14 days. So in 14 days, what we'll get to know is, so every 10 minutes there is a reading. So after food, how much is it? And you can try different type of diets as well in this. So you can try millet sometime, you can try brown rice, you can try white rice, you can try jowar. So you can try brown bread one day. So every body takes food in a different manner. I've seen some patients taking brown rice also, the sugar level gets spiked up. So you should take brown rice that time. So what kind of food suits you? That also this AGP will be telling you. So if you are unable to control your blood sugar, so within 14 days we'll put this AGP, and we'll get to know the estimated HbA1c also as well in that. So for HbA1c we have to wait for another 3 months. So within 14 days we'll get to know HbA1c, and daily sugars every minute to minute we can track it. So initially you can come after 5 days. We can try different type of treatments as well. So it will be useful for the doctor as well as the patient. So this is an advanced treatment which you can utilize. It is available in Dr. Mohan's Diabetes Specialty Center. Okay. So Sampath Kumar is asking, what are complications of diabetes? So Sampath, so complications of diabetes, as I have already discussed, from head to toe. So basically in head, there is high chance of getting stroke. We say paralysis. So if sugar levels are not under control, if your HbA1c is more than 7, fastings more than 180, postprandial more than 180, high chances of getting all these complications. So in head, it is first stroke. Coming to eyes. So in eyes, we have 3 major complications. One is glaucoma. Glaucoma means so increased pressure in the eye, which leads to damage of the eye. So next is you have cataract. Usually age-related cataracts are there that comes after 60 years. So in diabetes, if it is not under control, usually in 40, 45 years also you have diabetic cataracts. So you need to get the cataract surgery done. So next important complication is diabetic retinopathy. There is a called retina. So that retina gets affected. So yearly once eye checkup is definite mandatory. So these eye complications will not give you any symptoms. We don't know. So that is the reason we have to get the eye checkup done. And if it is in stage 1 or stage 2 of diabetic retinopathy, we can give some injections and prevent from further complications. So once the retina is gone, you'll become blind, you'll not able to see anything. So preventive health checkup is very much important. So Devendra Srimalli is saying, is glucobay 50 mg cause gastric problem? Yes, there definitely a bit of chance of having a gastric problem is there, as I have already discussed. So what glucobay does is, usually, so when a patient takes lot of carbohydrate intake, it will, what it does is, it will not make the carbohydrates from the get absorbed. So that is the main reason for causing gastric problems. So if you are having gastric problems due to glucobay, please change it or decrease the dose. Probably 50 mg, you can make it to 25 mg and see. But it is a good molecule if your postprandial spikes are high. So Revati is asking, sir, he's having loose motion last 3 months back now. It's controlled. He's taking Herbalife food and tablets as nutritional supplements. So I don't know what is there in Herbalife food and tablets. So if he's having loose motions, probably there may be an acute gastroenteritis, uh, or due to some tablets as well, he may have. But as you are saying, it is controlled now. So fine. I don't know what are there in those supplements. So please take care. See what are the contents, and please take it accordingly. So I cannot comment on that supplements. So Sukumar is saying, recently I was hospitalized for COVID infection. I am insulin dependent. 30 years taking Mixtar 30/70 twice a day. 20 units morning, 16 units night in the evening. Glycomet 0.5 twice. Jalra 50 in the afternoon. Okay, nice, Sukumarji. So you have got COVID infection, hospitalized. Hope you recovered well. Please frequently check your blood sugars, how your HbA1cs are there. So as you are taking a good amount of insulin as well as OHS, please continue to take it, and please monitor your blood sugars. So if you have any problems, let us know. Okay. So Raju is saying, hello doctor, I have taken 2 doses of Covishield vaccine. Exactly 6 months later, I was hospitalized with COVID virus. I was in ICU for 15 days. Oh, so bad. Followed by another 15 days under care in non-COVID ward. I am a diabetic under care of Dr. Mohan's clinic. Okay. So even though probably you are in ICU for 15 days, you had severe COVID infection. I understand in spite of the vaccination, but you survived, right? So ultimately you survived after the severe infection also. So God's grace is there. So why it happened, we have to see. Background, did you have any complications? Did you have a cardiac problem? Did you have a liver problem or kidney problem? So that also is important, because a patient with diabetes and cardiovascular problem, kidney problem, will take a longer time in hospital, because all the organs have to get healed. So that will take, and I don't know how your blood sugars are. So are you in a regular follow up with our clinics? So please follow up every minimum, at least minimum 3 months. So if your sugar levels are under control, probably this might not have happened. I don't know how your sugar levels are. So let us know. After that, I can comment. So Swami Yadav is saying, hi sir. For type 1, how long insulin should take? Currently, I am taking 4 times per day. So Swami Yadav, sorry to say, if you are type 1, you have to take insulin lifelong. So still there are some trials which are coming, stem cell therapy, etc., etc. So once weekly insulin, etc. Some trials are going on. If these kind of trials get successful, then probably this difficulty will vanish of taking 4 times insulin. So we can try, if your HbA1c and your sugar levels are under control, Swami Yadav, we can try for 3 times insulin, probably. We can try and give a trial for at least 3 months. Or if you are unable to take 4 times insulin, we have a latest technology called Insulin Pump. You don't have to poke multiple times. There is a small device called Insulin Pump. So that pump will directly give you insulin. So just press a button. You have to say how many insulin units you want. It's figured out. Your doctor will say, you press that button, automatically the insulin will go. So this 4 times pricking you can prevent by putting an insulin pump. So you can contact us for even insulin pump. We'll give a demo. We'll show you how it is useful. So with that also you will have low hypoglycemia, better sugar control. You don't have to poke this many times, and your amount of insulin also will decrease automatically. So your weight gain will decrease. So these are some advantages for type 1 if you put on insulin pump. So next, Karthik Mandal is asking, I am Karthik Mandal. I regularly taking insulin 10 plus 6 units. There is no result now. What can I do? Please advise me. Thanks, regards. So Karthik, let me know your sugars, what your sugars are, why it is not under control, which sugars are high, whether the fasting is high, postprandial is high, how much your HbA1c is. So how is your kidney? So some of the patients with kidney problems require more units of insulin. So background, what are your vital organ functions? I have to see. So where is the problem? Whether diet is the problem, exercise is the problem, why you are not able to control your sugars, we have to see. So there is a solution for every problem. So what we do is, when a patient enters into Dr. Mohan's diabetes, basically what we do, we first diagnose what sugar it is. So whether it is type 1, type 2, there are many types of sugars, almost 30 varieties of sugars are there. Whether it is type 1, type 2, or it is MODY, or it is latent onset adult diabetes, LADA we say. So it is very important. So less than 30, 32 years of age, it is better to know what diabetes it is. So first it is better to know, if you want to know what diabetes it is, you can do a test called C-peptide. So C-peptide test, what it tells is whether there is sufficient insulin secretion or not. If there is no insufficient insulin secretion or it is very low, I mean to say, then further investigation is required. If it is low, it goes in more favor of type 1, MODY, LADA, etc. and some genetic syndromes as well. If the insulin secretion is good enough, more in favor of type 2. So 90% of the cases mostly are type 2 diabetes only. So 10% of the cases are other types of diabetes, but we have to diagnose it. Not like every patient comes, we write some insulin, write some tablets, so yours is type 2, go. So that treatment has gone. So now it is precision diabetes. You should know what the disease is, what you are taking, why you are taking, and what are the complications. First you have to know what the disease is, then you have to know why you are taking treatment. Okay, so next Devendra is saying explain scale level of C-peptide. So C-peptide, there are different types of scales. So the maximum is 4, so minimum is around 1.5. so it depends how much is it, whether you are fasting. We do C-peptide also 2 times. One is fasting, one is postprandial, just like a fasting sugar and PP sugar. So we say fasting C-peptide levels and stimulated C-peptide levels. So this C-peptide we see. So whether it is, there are 4 grades usually. So whether it is excellent, fairly good, it is poor or negligible. So usually if it is in the first 2 stages, it is good. Good amount of insulin secretion is there. You go more in favor of type 2 diabetes. If it is poor or negligible, you go in favor of type 1 or other types of diabetes. This is the scale of C-peptide. So Bollam Raju is saying my HbA1c 7, is insulin necessary? So HbA1c of 7, usually insulin is not necessary. But if you are other vital organs are affected, probably if you have a kidney damage or a kidney problem, then in this kind of situation, it is better to take insulin. So what your vital organ functions is important. But usually we start if the HbA1c is more than 8 to 9, we straight away start insulin. And if it is a new onset diabetes with HbA1c of 9 or more, for the first month, if we give insulin, the results are better. So Bollam Raju is saying my fasting is 80 to 100. Okay, very good, Bollam Raju garu. So it is under good control fasting, and your postprandial also should be less than 180. So Sandeep Kumar is saying how often brown rice should be taken? I mean in a day, only once. So carbohydrate intake very much important. Brown rice should be taken only once. Better to take it in the afternoon, not in the nights, because gastric emptying is very low in the nights. And what patients do, especially Indian patients, what do they do? Even though they have rice, they take it around 9, 9:30. They sleep around 10:30. So the digestion doesn't happen, and the metabolic rate goes down as you sleep. So what happens is the blood sugars are high from night till the morning. I have seen in many AGPs. So I told you this chip. So in this chip, what the importance is? We can see overall sugars. So I have seen patients who take rice in the night and immediately sleep within 1.5 hours. What happens is blood sugars are around 200, 250 till early morning 6 o'clock. Even though they don't eat anything, their sugars are high. So this mistake you don't do. Take brown rice, but take it in the afternoon. That too only a cup of rice, not more than that. It depends on how your blood sugars are. If your blood sugars are under control, okay, you can relax a bit. So I have diabetes border. I didn't get you, Rameshwara. So my baby, 5 years, baby suffering. So sorry, Sureka Garu. So I know young diabetes, kids who have diabetes, obviously it's a suffering to parents as well as kids, but at least it's treatable, right? It's not a cancer. So you should have hope. So in our Mohan's diabetes, we have patients who have lived up to 60, 70 years, 100 years as well with type 1 diabetes. So you get inspiration from there. And I have kids as well. I treat around 15 to 20 kids who are 5 years, 6 years, 7 years, 8 years, who are diabetic. So you can talk to your peers with other parents who are whose kids are diabetic, so that you can build in some confidence in you as well as in your kids. So don't feel ugly that or bad that your baby got diabetes. Still, it is treatable. It is controllable. So can't you suggest only long-acting insulin once a day only instead of 2 to 3 times? Srinivas Garu, definitely we can suggest long-acting once a day for sure, but it depends on how your blood sugars are instead of 2 to 3 times. So it depends how your blood sugars are. We can put a one long-acting, but with long-acting insulin, we have to put you on some OHS as well. Only long-acting insulin will not cover, because the postprandial spikes also should be covered. Either it should be with 2 OHS, one long-acting insulin, or 3 OHS with long-acting insulin, or dual insulin like a mixtard or something with 30-70 ratio. So that you can take it 2 times with 1 OHS. So there are multiple combinations that your doctor will decide. It depends. It changes from patient to patient. So Naresh is asking, COVID during pregnancy along with diabetes, is it dangerous, sir? Wow, Naresh, very good question. Yes, definitely. So COVID during pregnancy, I have seen around 4 to 5 cases in past 4 to 5 days only. So yes, obviously it is very dangerous. You should have a very stringent blood sugar control. But this Omicron variant is not killing patients, is not getting more severe. So even in pregnancy also, they have come out within 4 to 5 days, no severe symptoms, no SOB. So important thing here is early diagnosis. Uh, as early as possible, when they have a fever, cold, cough, consult your doctor, do the advised blood test, and get treated. And obviously, in pregnancy, we only give insulin. Uh, Other than insulin, we can just give metformin, and frequent SMBG is important if COVID with pregnancy and diabetes. And your sugar levels should be under control. In pregnancy, it should be less. Your fasting should be less than 90 only, and postprandial blood sugar should be less than 120, because it will harm the patient baby as well. So 2 lives. So Srinivas Garu is saying, sir, my mother is getting more sweat at night time, even in winter season, and at only night time breathing problem also coming. So the reason for sweating, if she's a diabetic, if she's having sweat in the night time, first thing we have to see is whether she's having hypoglycemia, that is low sugars. So first what you do is, in the night time when she's having sweating, please check the blood sugar. If the blood sugar is less than 70, then we have to decrease the insulin or OHA dose. So that is one possibility. So other possibility is excessive sweating can be seen in other diseases, in thyroid disorders as well. Get a thyroid test as well. So in diabetic patients, even in winter with sweating, one you have to rule out is hypoglycemia, whether low sugars are happening. Next thing is thyroid. Have a thyroid check done, and she's having breathing problem also. So why she's having breathing problem? Is it obstructive sleep apnea, which can happen if they are obese? They have more fat in the neck area, so that can happen. Is she waking up in the night due to breathing problem? That is important. Or does she have asthma or COPD, like any airway diseases? You have to see. So Swarnalata is saying, good evening, sir. If I have type 1 diabetes, are my children at risk? Yes, obviously, Swarna. If type 1 diabetic parent, definitely the children also may have a risk of getting diabetes. So frequent monitoring is required. So both parents diabetic or generation to generation diabetic, all kids and siblings should get frequent sugar testing done, because there is a genetic problem in type 1 diabetes in Modi. So definitely they have to get screened. So Rajendra is asking, not hospitalized, no COVID as on today. Shall I go under RT-PCR test? My father is also living on insulin, cardio, sugar medicine. So why do you want to get RT-PCR test done? Are you having any symptoms? So if Rajendra Garu, if you are having some symptoms of what I mentioned, fever, cold, cough, weakness, breathlessness, loose motions, etc., all any kind of symptoms, you get it done. Because if you getting your father getting it, there is a high chance as is diabetic. So if anyone in the house has symptoms, so please move away, isolate yourself from the elderly and children. So that you have to do. Otherwise, if they get it, the chance of getting severe COVID infection is very much high. So if you have symptoms, please get a test done. So Swami Yadav, sir, may I know what is the insulin pump cost approximately? So Swami Yadav, definitely you can contact us. There are various costs of insulin. There are various pumps, anywhere between 2 lakhs or so to 6-7 lakhs also it is there. So how much cost it will make you, how affordable it is. Don't think about the cost first. So how beneficial it is, you just think about. Rather than poking 4 times with a single button, and we have a latest pump as well, 780G. So what that pump does is, we put a sensor and pump as well. So automatically what the sensor does is, it will automatically take how much is the sugar. Suppose the sugar goes below 70, so automatically the pump shutdowns and it will not give insulin. Suppose the sugars are high, or say 400, 300. So the pump automatically, it will calculate the amount of insulin and it will give it off. So automatically it acts like an artificial pancreas. So advanced treatments are there. So please write to us regarding the pump, how it is, how it acts. We'll give you a demo, and please visit us so that for further detailed explanation, we'll get to know what it is. Okay. So Rajendra is asking, all organs are functioning normally, of course, with medicines. Okay, then fine. If all organs are functioning okay, then please continue the medicine. Swarnalata is saying, are people with diabetes more likely to get COVID-19? No, absolutely no. People with diabetes, with non-diabetes, normal people have equal chance of getting diabetes. There is nothing like that with diabetes. People who are diabetic will have more chance of getting. Uncontrolled diabetes, uncontrolled diabetic people whose HbA1cs are more than 7, sugars are high, have a more tendency of getting not only COVID infection, any infection per se. So, and I am suffering tingling, numbness in foot and tingling in backside of neck. Okay, so Rajendra Garu, probably you are having diabetic neuropathy. So we have a test called biothiometry. So we can do that test. We'll get to know how much your nerves are affected. With that, we can put you on some medication to relieve the symptoms from numbness, tingling. So I think your blood sugars are not under control, or previously they were out of control, which affects the nerves. So that is a complication of diabetes only, uncontrolled diabetes. We call it the diabetic neuropathy. So there are some medicines which we can write, and you'll get some relief from the symptoms. So night food for type 1. For any diabetic, type 1 or type 2, for anyone it is diabetic diet. For night food, what you have to do is avoid carbohydrate itself, or very low carbohydrate. Just take jowar roti, or take oats, or lighter food with some vegetable curry, with a salad, with cucumber. So these kind of foods you can take. Take it early, and you have to maintain at least a 2.5 hour gap between your dinner time and your sleeping time. So Swarnalata is asking, are we at higher risk of getting COVID-19 if your diabetes isn't well damaged? Definitely this is a yes, Swarnalata. So this is what I was saying. If your diabetes is not under control, the reason of getting diabetes under control is to avoid complications and other opportunities in infections. So that is important. And she's asking, can some diabetic medicines amplify the immune response to COVID-19? So there are some medicines which you have to avoid if you get COVID-19. So as per say, diabetic medicine increasing the chance of COVID-19 is not seen. So I think you are asking, as you are using some diabetic medicine, is there a chance of getting COVID infection? No. But if you get a COVID-19 infection, you have to change some diabetic medicines if it is a severe COVID infection, like SGLT2 inhibitors you have to avoid, and thiazolidones you have to avoid, and change it to another group of medicines. So that is the reason. Post-COVID also, please consult your diabetologists or physicians, your treating doctors, whether if required they will change the medicines or put your insulin for some time. Still you are back to normal. So what vaccines are recommended for diabetics? So vaccines that are recommended for diabetics are first COVID vaccine. So don't forget COVID vaccine. Take 2 doses of COVID vaccine, and now who are eligible for the booster, take the booster as well. After that, take influenza vaccine, pneumococcal vaccine, mandatory vaccines definitely, and even you have to take a hepatitis vaccine as well if you are not vaccinated. So these three are important. So if you are not getting vaccines anywhere, so in all non-diabetic clinics, influenza vaccines, pneumococcal vaccines are given year long. Anytime you can visit us and take the vaccine. So Saab Billeshwara is asking, in type 1 diabetic, kindly advise what type of food should be taken. Lunchtime takes rice, nighttime chapati. Is it sufficient along with yes? Yes, you can definitely take in the lunch. You can take rice, specifically brown rice is better. It will have a good glycemic control. And nighttime, obviously chapati, but wheat, better to avoid wheat as well. Better to take multi-grain mixture of all grains so that the glycemic index will come down. Or plain jowar also, you can take jowar chapati also you can take with curries. Have lot of curry, little roti or chapati. Okay. So how are cholesterol, BP and blood sugar related, doctor? Yes. So BP for all diabetic patients have a more prone of getting high cholesterol levels. So diabetes, thyroid, cholesterol all go hand in hand. So many people ask me, so doctor, I don't eat any fatty food. I'm in a good diet and control. So why my cholesterol is high? I'm thin as well, they say. There's nothing like that. If you are thin, you don't have cholesterol. If you are fat, you have cholesterol. Nothing like that. So basically, diabetic people have a more tendency of having dyslipidemia. We say diabetic dyslipidemia. So in this, the triglyceride levels are usually high. The LDL levels are usually high. So regular cholesterol checkup is important because if you have a high cholesterol levels, there is a chance of getting heart attack. And blood pressure control also so is very much important because high blood pressure can affect your diabetes as well as your kidney. So Power is asking, after taking Glynas MF tablet, I will so hunger. Sir, tell me the reason. So Glynas MF, after taking, you are feeling more hungry. So how long is it taking for your hunger to come up is important. Are your blood sugars under control is important. So probably is the dose becoming high. So please check your blood sugars when you are getting hungry. That is important. And we can decide on the dosing of Glynas MF. So Dr. Nikita is saying, posting on behalf of my relative, my fasting blood sugar fluctuates between 80 to 90 despite high sugar diet. Sometimes it goes up to 100. Okay, fasting is going up to 100. I checked my PPG today and it was 104 after complete lunch. I feel very weak and low when my sugar drops below 90. So to manage the sugar levels, I am forced to consume high sugar diet, which has led to excessive weight gain. When I reduce my diet in order to manage weight, my BP sugar decreases. I consulted my doctor here and my full body checkup showed. Okay. So why you are having low sugars, that is important. Are you having high insulin levels? So check a fasting insulin level, you can see. So please check that test done. If your insulin levels in the body are high, there are high chances of getting low sugars. So there are some diseases like pancreatic disorders, which can cause high blood sugars. So you have to get screened for it, and you have to get an ultrasonography also better to get it done. So what is the reason of low sugars? I think you are not diabetic. I don't know whether you are diabetic or not. First, I have to know that. So if you are diabetic, that is a different scenario. If you are asking in a non-diabetic patient, the scenario is different. So Kalpud is asking, will millets help? Yes, obviously millets will help. They have a very low glycemic index. Some millets, not all millets. So the glycemic variability also will decrease if you have millets. So sir, glycemic index is same in rice and wheat. And then why it is advised to take wheat in the night and suffering from insomnia? Is there any way? Yes, obviously I told you right now. Glycemic index of rice and wheat. I did not say have wheat. That is the reason I said have multigrain or jowar. That is better. Or you can have wheat which is unpolished. So nowadays wheat is also polished. So glycemic index is same. Whether you have rice or wheat, it is the same amount of blood sugars will increase. So if you are having insomnia, probably as your stomach is not full, you are having insomnia. So what you do is take a jowar roti, fill your stomach with the vegetable curry. Have more amount of curry, have a cucumber salad, have some sprouts. You can fill your stomach with that so that your insomnia will go. Okay. So, sir, is snack time we can take Mary biscuit. So, you mean to say marigold biscuit in evening time? Yes, better to take sugar-free biscuit rather than any kind of other biscuits. But marigold, I think it has less amount of sugar in it. But better to take sugar-free biscuits only as they are available. So Rajendra is saying for how long we should be on medicines when sugars are controlled. Suppose I mean to say if your sugars are under control, I mean to say is if your HbA1c is 6.5, your fasting is, I mean to say, less than 100, postprandial less than 160 or 180. So what we can try is, suppose you are on 2 OHs only. So what we can do is decrease it to 1 OHA, decrease it to only 1 tablet. Recheck your blood sugars after 3 months. If it is again in the similar position, taper that 1 tablet also to half dose. Continue for another 3 months. Have regular checkup. If again after 3 months also it is in the similar position, then we can hold the tablet and see with only diet and exercise, lifestyle modification. We'll look it after around next 3 months. If the sugars are under control with lifestyle modification, yes, you can stop the tablets. But this is only possible in type 2 diabetes, not in type 1 diabetes. Okay. So this kind of treatment we are doing, I have around 10-12 patients who are not under any medication, only with diet and exercise. They regularly come to me. Sometimes their sugar levels go up. That time I put a tablet. Again 3 months they come back. They do diet exercise. They are very disciplined, very oriented. Then I take off the tablet. So again I give a 3 months time to them. So if their sugars are under control, they are off the tablet. So sugar is a disease if it is controllable. So it is the willpower of the patient and the advice of the doctor. That's it. So for how long should we, okay, this was over. So Power Lava is saying, sir, type 2 diabetes can cure or permanently age is 57. There is no cure for type 1 or type 2 or anything. Okay. So it is diabetes is just controllable. You have to control it. Be disciplined. So is reversal possible for patients with blood sugar, BP, cholesterol? Yes, reversal, yes, it is possible. Diabetes reversal, I think Cynthia is asking. So reversal is possible in the only initial days. So if the patient from the date of onset, there are some criteria whether reversal is possible or not. So reversal is usually possible in obese patient. If you have a weight loss of around 15 kgs, the pancreatic fat which is there, that can also cause decreased insulin secretion. So if you have weight loss, that pancreatic fat will decrease. So your insulin resistance will decrease and it should be sustainable. The weight loss should be sustainable. It's not like you decrease 15 kgs and then put on 10 kgs. The diabetes will come back. So first thing, weight loss is important for reversal. Second thing is you should have a good C-peptide. So at onset of diagnosis, only C-peptide is important for reversal. If you have a good C-peptide, then definitely the reversal chance is high. So as there is insulin secretion, if you have a weight loss and regular checkup with some OHs, down the lane within onset of diabetes, less than 5 years, the reversal chances are high. So I don't think any more questions are there. So probably I will conclude the session here. I'll wait for another 1 or 2 minutes. If there are no further questions, we'll conclude. So just take the precautions which I have suggested. So the tips are, I'll just repeat the tips once. So wash your hands regularly, at least for around 20 seconds. So with soap and water, or if you don't have soap and water, at least with sanitizer, which has 60% alcohol. Avoid touching your face with your hands. because you don't know, you touch here, there, put it in your nose, mouth. So avoid touching face only. Okay. If you have to cough, cough in the mask. And if you coughed in the mask, remove the mask and throw it or wash it if it is a washable mask. Or else if you want to cough, don't cough on your hands like this. So cough on your elbow like this. So that it stays away here and you change your clothes. It will not come onto your face again. So this should be so that you will not get the infection and you will not transmit, because hands transmit all infections, not only COVID. So next is masking is very much important. I've already told how to wear a mask. So follow that. Next, clean all your surfaces. Go home, take a fresh bath with hot water daily during this pandemic at least. So have a good sleep of at least 8 hours. Uh, don't have any stress. So de-stress activities, please follow de-stress activities and stay in a relaxed manner. Don't get panic hearing some news here, COVID, there, COVID, that relative died, this relative died. Whoever has to die will die. It is God's fate. That's it. You take your precautions first. That's it. So I have some questions here. So I am a wild. Villeshwar is saying, sir, millets తినేటప్పుడు షుగర్ లెవెల్స్ పెరిగేవి, రైస్ స్టార్ట్ చేస్తే కొంతవరకు కంట్రోల్ గా వచ్చేవి, ఇన్సులిన్ కాంపోజిషన్ ఎలా క్యాలిక్యులేట్ చేయాలి? సో ఇన్సులిన్ కాంపోజిషన్ క్యాలిక్యులేట్ చేయాలంటే కార్బోహైడ్రేట్ టు ఇన్సులిన్ రేషియో ఉంటుంది. సో 25 కార్బోహైడ్రేట్స్ కి ఇంత ఇన్సులిన్ ఇవ్వాలనే క్యాలిక్యులేషన్ ఉంటుంది. సో మమ్మల్ని సంప్రదించండి, మీరు ఏం తింటున్నారు, ఎలా పెరుగుతున్నాయి. సో మీరు అంటున్నారు మిల్లెట్స్ తిన్నప్పుడు కూడా షుగర్ లెవెల్స్. ఎస్, కొన్ని టైప్స్ ఆఫ్ మిల్లెట్స్ తింటే కూడా షుగర్స్ పెరుగుతున్నాయి. సో ఈ మిల్లెట్స్ లో కూడా చాలా కల్తీలు వస్తున్నాయి. సో అన్పాలిష్డ్ మిల్లెట్స్ ఇంపార్టెంట్. మిల్లెట్స్ కూడా పాలిష్ చేశారు అనుకోండి, ఆబ్వియస్లీ షుగర్ లెవెల్స్ పెరుగుతాయి. సో దట్ ఈస్ ఈక్వలెంట్ టు రైస్ అగైన్ మిల్లెట్స్ కూడా. సో అన్పాలిష్డ్ మిల్లెట్స్ ఆర్ ఇంపార్టెంట్. మిల్లెట్స్ లో కూడా చాలా వెరైటీస్ ఉన్నాయి. సో సమ్ కైండ్ ఆఫ్ మిల్లెట్స్ తోని షుగర్ లెవెల్స్ పెరుగుతాయి. సో ప్లీజ్ కాంటాక్ట్ us. What diet is important, how much you have to calculate, how insulin composition has to be changed. I cannot educate online immediately. So I'll give a detailed class, or you can write to us. You just write an email so that I can answer back. Okay. So Devendra is saying, I am a wildlife photographer. Sometime in jungle, I don't have insulin and medicine. Can I take food and apply insulin after coming home? So in the jungle, so I mean to say, Devendra ji, if you are not having any food there, even if you don't take tablet or insulin, it's okay. But if you are having some food there, obviously your sugar levels will go high. So obviously you should have some tablet or insulin for sure. So after coming home and taking insulin, but that time your blood sugars will be obviously high, then your HbA1c will be high. Even though you are a photographer, I understand. Carry some water and your medicine along with some food. Okay. After reversal, medicine are required. So Power is saying, once the reversal is done, medicines are obviously not required, but regular monitoring is required. So again, after the reversal is done, suppose you say your HbA1c are maintained around 6 months or 1 year. Again, you start to eat, you don't exercise, you stay relaxed, have full carbohydrates nicely. Again, sugar levels will go high. So that is not reversal. Again, re-reversal will happen. So what happens? Again, your blood sugars will go high. That time again we have to give tablet. So reversal also, the term reversal is not correct actually. We have to say remission, because remission means it has come down for some time. How long it will stay, we don't know. So per se, this reversal has become a fashion now. So everyone is using that term reversal, but there is no reversal for diabetes. So please post. So we are saying, if you have any comments, doubts, yes, please post. So there are some more. Can I continue Niftas 50 mg and Silodol 8 mg, which I was using since last 6 months in view of COVID? No. So Silodol D is for your prostate problem, Rajender. So why you are taking since last COVID, I don't know. Niftas 50 is an antibiotic which we give for urinary tract infections. So why you are taking since 6 months, I do not know. Please consult the doctor who has prescribed this, or write to us what problem you are having. Other problems are, do you have a prostate problem is very much important. So why you are taking this medicine is very much important. If you have a prostate problem, you can continue Silodol. But Niftas is an antibiotic, you don't have to take it for a longer time. Okay. So Satvik is saying, can a diabetic eat? What is this? Eat. Is this maize? Huh? I am unable to recognize. So what is this? I cannot. If it is maize, you should avoid maize. Maize also increases blood sugar. So Revati is saying he is having gastric problem. Shall I reduce sugar tablet? Revati ji, we have to find out what the gastric problem is, why it is happening. Is it an ulcer inside? So endoscopy may be required. What is the problem? We have to taper down some medication and see. It is we have to see whether it is happening to the sugar tablet or ecosprin. So that we have to find out. Please consult your doctor. I don't think it's happening due to sugar tablet because it doesn't have any alpha glucosidase inhibitor. So difference between tablets and insulin. So difference between tablets and insulin is tablet mechanism of action is different. Insulin mechanism of action is different. There are 8 types of pathophysiological defects in diabetes. So each tablets act in a different way. So which tablet is suited for which diabetic patient will be decided by the different morphology of the patient, whether he's thin, whether he's obese, whether he has background vital organ dysfunction like kidney problem, liver problem. So every patient medicine will differ. So that is the difference between tablet and insulin. So there are less side effects with insulin compared to the tablets. That much I can say. So Sadwala says, sir, my mother tested in Mohan's hospital week before and she got 450 sugar. She is type 1. She is drinking Karela juice. Sugar will get in control, sir. So only with Karela juice, sugar will not get control, Sadwala ji. You need sufficient dose of insulin as advised by one of our doctors in Mohan's only. So please follow his or her advice. Follow our dietitian's advice. And your sugars will be under control. If your sugars are not getting under control, please try an EGP. Definitely will get your sugars under control. Yes, Satvik, I understood that was maize, that is corn. Corn will increase your blood sugars. So you can take anything but in a limited quantity. Don't take this much because corn also has some beneficial effects. Take it a bit and avoid carbohydrates on that day. That's it. JP saying, I like your live video. Thanks, JP. Sir, is stevia sweetener safe? Yes, Satvik, obviously stevia is a plant-based sweetener. Definitely you can take it only in a limited quantity for your tea, coffee, milk, etc. Do not mix sweets, pongal, etc. and with the sweeteners. Only for tea, coffee, etc. So which fruits are best for diabetic? Power is asking. So fruits wise, you can have apple. Citrus fruits you can have orange, mosambi you can have, pomegranate you can have, kiwi you can have, dragon fruit you can have. Okay, so these are all low glycemic index fruits that I am saying. So one fruit per day is sufficient. Don't take too many fruits also because all fruits have fructose as well. But with fruits, in fruits there are antioxidants, vitamins, minerals, everything is there. So everything is important in life. So in limited quantities, everything is good. So that's it. I think there are no more questions. I'll end the live show. So thank you. If you have any questions, please post us back. In the scrolling, you have our number and contact us. Thank you.